Aloha, everyone. I was just checking to make sure we're live, and we are. I'm Pamela Tumpot, president of the Maui Chamber of Commerce, and we want to welcome you to our annual Board of Directors Installation Luncheon. And we're going to have great speakers today. We're going to have a coming message from and board installation from Mayor Michael Victorino, as well as a keynote address and Q&A session with Governor David Ige. You know, our world has changed over the past few months with COVID-19 and the pandemic, and including how we hold events like this. But we are so excited to be able to be here and connect with you today to honor our incoming board of directors and to hear from key leaders as we plan forward to better times. Over the past year, the Maui Chamber of Commerce has accomplished many things. We held 8 business after hours. While we had 3 more planned, and we had additional luncheon events planned, COVID-19 had its own plans. So those were, of course, postponed, but we are looking forward to bringing those back later in the year, either online or when we can figure out a way to hold them with the crowds and do more social distancing. Major events and activities that happened since last July included the Mayor's Luncheon in the month of July, the Mayor's Small Business Awards in September, a partnership with the Mayor and his office, as well as the County of Maui, on the first Maui Nui Attainable Housing Forum in October. In November, we held the 6th annual Made in Maui County Festival, which is also done in partnership with the Mayor's Office and the County of Maui and Office of Economic Development, along with many volunteers and a great advisory committee. This year, we hope to hold the 7th annual Made in Maui County Festival on November 6th and 7th, but literally only time will tell. Applications are already in from vendors, and we plan to wait until August to make our final decision. But we are moving forward in the hopes that we continue to have this great outdoor event that people love, while also planning and exploring other options in the meantime. We assisted and participated in the Pukalani Christmas Fair and Electric Golf Cart Parade in December. We held the Hawaiian Airlines Luncheon with Peter Ingram in January. We celebrated the Chamber's 110th anniversary with Biz Mix Maui, our new membership celebration and fundraising event in March. And we were so grateful to hold it at UHMC. It was a beautiful venue, and thankfully, it was the week before we started looking at the stay-at-home, work-at-home shutdown orders. So we just got that in barely before COVID really started to hit, and we became more aware of how we needed to protect ourselves and look at a new norm. In addition, this past year, we have provided advocacy throughout the legislative session, county council meetings, and budget session, supporting measures that help and strongly opposing measures that hurt businesses. We had a trade council. The Construction Industry of Maui Trade Council had an excellent year this year. They held their home show in August, held monthly pauhanas, and they had their fabulous holiday party. Additionally, they just gave away 2 $15,000 scholarships to graduating high school seniors with a focus on entering construction-related programs. Like all of you, COVID-19 has forced us to change some of our plans and the way we do things. But we have also used this opportunity to refocus, develop new programs, partnerships, and do more member assistance. We partnered with the County of Maui and the Mayor's Office on the Micro Business Loan Program, and we're able to give out over $1 million worth of loans to 60 small businesses. The need was $2.5 million. But the challenge is, right now during these times, everyone's in need. And it was just announced this $150,000 to continue the program, for which we and the recipients of those funds will be very grateful. We are all working hard to save as many families and businesses as possible during this time. And we are looking forward to helping even more as additional funding becomes available through the CARES Act. We also work with the county to provide PPE to small businesses so they could reopen safely. and want to thank member Maui Brewing Company for graciously donating over 600 bottles of hand sanitizer that are being distributed to businesses. PPE and hand sanitizer are still available, so please contact us if you need some. Most importantly, we are proud to serve you, our members and the backbone of this community during this time. We are working hard to help our members stay abreast of constantly changing federal, state, and county emergency rules, loan and grant opportunities, and to specifically assist members and all businesses with specialized help given their individual circumstances. I have also served on multiple COVID-19 task forces and committees as the voice of Maui business on county, state, and national levels. As we move into this new fiscal year, we will continue to explore new ways to serve our members and the community in this new normal. As always, we welcome your ideas and insight. This is clearly a time for unity, and together we will all get through this stronger. Now, before I introduce Mayor Michael Victorino, we need to have a short member business meeting to approve our slate of directors. We will be doing this a little bit differently this year than we have in the past. So members, please see the list of incoming directors on the screen now. Then when I ask the question, I'm going to ask you to virtually raise your hand when I call for those to approve the slate by clicking on the white hand in the red circle symbol at the bottom of your screen. I'm going to ask our directors, if possible, to unmute yourself and to bring your video up so people can see you. I'm going to ask our non-members who are on this call to please give us a brief moment as we take this vote. It won't be too long, so I appreciate your patience. Okay, members, if you're ready, please click on the hand symbol if you approve of the slate of directors as shown on the screen. Please leave it clicked until we hear from Amber, who will be tallying the votes.
Okay, thank you everyone. I will lower all of your hands now.
Okay, I'm going to give her a few seconds to do that. And then I'm going to ask if any is opposed. Members, if you're opposed to this slate of directors, you may raise your hand virtually by clicking on the hand signal with the red circle. And keep that up. Amber will let you know when she's tallied any votes.
Okay, thank you. Seeing none unapproved.
Fantastic. So if there's none unapproved, that means the slate of the incoming board of directors is approved. Yeah. You can all cheer in your own homes or places where you're watching today. But congratulations to our 2021 Maui Chamber of Commerce Board of Directors. We appreciate your tremendous service to our organization. And thank you again for stepping up to serve. You know, it's when we go through tough times that we quickly see the strengths and weaknesses of people and their leadership abilities. And while Mayor Victorino has always been known for being a strong leader, the way he immediately jumped into action with COVID-19, mobilizing every resource and his entire team to put the people of Maui County first was remarkable. He created a number of forums and task forces to engage various sectors of the community in planning. He urgently implemented emergency programs to help individuals and businesses in gap groups that were most in need and going to be overlooked by other programs. Unprecedented programs like the micro business loan program were created along with others, and an astounding amount of time was put in to make this happen quickly. While we still face great and growing hardships and concerns over public and economic health, along with systems that need to be addressed in times that literally can change minute by minute. Our mayor is on the forefront, doing everything possible to keep Maui strong and no ko'oi, and we are grateful. So I now turn to Mayor Michael Victorino for his message.
Okay. I hope I'm on. Aloha, everyone. And I hope you can hear me because this is so different. Keep doing it. This is my second or third conference via Zoom, and I still haven't learned all the nuances, but I'm working hard at it. First of all, thank you, Pamela, for those wonderful comments. But it's the people of Maui County, the people of Maui County, the businesses of Maui County that really make a difference. I'm blessed to have a great core of people out there, not only the team that works with me, but the nonprofits, the business sector, other agencies, both federal and state, that have continuously come to the table when asked to, and be providing not only information, but also the aspect of how can we do this better. This is unprecedented times. There's no question. Nowhere in our history have we ever seen such a major downturn of the economy, and immediate and profound. Even 9/11, none of us recall this kind of a downturn. Yes, we heard, but we knew our enemy, and we knew where we wanted to go, and we knew what resolve we had and the patriotism that was brought in during that unprecedented time. This is an invisible enemy. It's a virus, and it's something that we've not put our fingers on even till today. Our medical world has worked vehemently trying to figure out how to find ways to find answers, whether it's a vaccine or whatever. And it's been very difficult. And I give them a lot of credit. I respond to their wishes when they call upon me, just like you. You are the backbone. And now we are at this point where recovery is now the major topic. We're going to do it safely. We're going to do it systematically and methodically. No question in my mind. But I will also say that we all have to continue to work in concert. It's not about me. It's not about you. It's about we, the people of Maui County. And as you heard yesterday, we've now decided as a collective body, and I was with the governor yesterday, that we will now look to open up on August 1st to bring outside visitors back to our state. This is a dangerous situation in the sense of we're not sure what the resolve will be. We've seen the results in Texas, California, Florida, et cetera, and they've not been good to this point. But we're also learning and watching from them how and what they did maybe wrong, maybe what they're doing right, and trying to emulate. So we've got a month to get ready. And I believe both the hospitality industry, the small businesses, big businesses, and the people of Maui County, nonprofits, etc., can all come to the table now and try to work on systems that will make Maui no ko'oi again. It's going to take time, gang, and we're nowhere out of the woods. But today I can report again 0 new cases. Kauai had 5 and Oahu had a double digit again. It's still out there. So we can't sit on our laurels and say, never mind, don't worry, everything's fine. But recovering economically is so very important. Our economy cannot stay in this kind of a downturn. Our people need jobs, our people need services, our visitors want to come. Well, let's do it, but let's do it better than we ever did it before. Let's look at quality, not quantity. Let's do it how we all know it can work and work better. And that's something we all need to come to the table and help us put it together. We don't need 24,000 cars roaming around our roads along with our cars. Maybe we can do it differently. I'm not sure. But most importantly, I'm going to count on the business community to help me create or to enhance or to develop additional diversification of our economy. We cannot depend on hospitality entirely. We've seen the residual effect both at 9/11, the Great Recession of 2008 and 9, and here we are again. And insanity is when you continue doing the same thing and getting the same results. and I'm not insane, so I'm sorry. So we'll make those changes. We'll work together, and I believe this is a crucial point in our time when we can show the world Maui and the state of Hawaii could be leaders in many other areas other than hospitality. But hospitality, let's be honest, will be our #1 economic engine for decades, if not longer. So we need to make sure we shore it up, make it strong again, and then everything else can come about or come around it. So with your help, I believe we can and we will do it. So I want to wish all of you continued success in this new virtual world we live in, and how we all can continue to work together. And Pamela, thank you for all of your leadership, and to all of you out there, thank you for your support. I know sometimes I can be a bear, but when it's got to be done, we're going to get it done. So God bless you all. Thank you so very much.
Thank you, Mayor. Thank you so very much. Again, we are very grateful for all that you're doing and continue to do. And we deeply appreciate, you know, when you ran for office, you always said, it's not about me, it's about we, and you have proven that time and time again by involving us all and giving us opportunities to have a voice and share with you suggestions and ways that we're struggling, and you do whatever you can to make it right and push things forward, and we deeply appreciate that.
My pleasure, and I'm honored, and I'm thankful you've given me this opportunity, and together we'll make it come out good.
Thank you, Mayor.
So are we ready now for the swearing in?
Yes, we can.
Okay, because you know I've got to run to another blessing, so I have my script here, so I'm going to read off my script, everyone. So please excuse me. I didn't have a chance to practice, but I think I got it.
Awesome.
Each of you have been selected as a Maui Chamber of Commerce Director because you have considered to be a leader in your have been considered to be a leader in this profession and in the community. Your willingness and ability to support the goals and objectives of Maui Chamber of Commerce is a welcomed asset. As you know, the Maui Chamber of Commerce is a membership organization made up of diverse businesses of all sizes. The organization's mission is to advance and promote a healthy environment for business and advocate responsive government and quality education while preserving Maui's unique community characteristics. As a member of the Maui Chamber of Commerce, you are here to help determine and uphold the organization's mission and direction. Regularly attending meetings, even though they may be through Zoom, support effective planning and ensure adequate resources for the organization, assist in managing these resources effectively, and monitor the organization's programs and service, hence the organization's public image, and place your talent and resources at the disposal of the Chamber in carrying out its mission and programs. When I call the question, please raise your right hand and respond affirmatively by saying, I will. Okay? Will you all carry out the duties as described to you? I hope you guys, yeah, this. Everybody's raising their hand. Great. It's hard. I'm sorry. This is difficult, but please forgive me.
I will.
Okay? And directors, welcome to the Maui Chamber of Commerce Board of Directors. The Chamber members and honored guests, please welcome your 2020 and 21 Board of Directors. Let's give them a big hand, virtually and otherwise. And I'm going to ask you one question. All of you, do you swear you will do this?
I will.
I will.
I got it, Pam. So I'm sorry, a little different, but please forgive me. But thank you, congratulations. I know you have an outstanding core of leadership as directors, and with Pamela's guidance and all of us working together, we will come out of this pandemic better than we went in. It'll take time. I'm not assuring it'll be next week, next month, next year, or years to come. But if we stay determined and committed to the path I believe Maui County can set, and the example for the rest of the state. We will stand tall and we will be Maui strong. God bless you all. Thank you very much and congratulations.
Thank you, Mayor.
Thank
Thank you so much for your time. I know every day is a crazy scheduled day, and you're always making sure you get to as many things as possible. So thank you for making time for us today.
And please forgive me, I can't stay longer, but I'm off to Kauluilani for their blessing. God bless you all and aloha.
Thank you. Aloha. Please share our blessing with them as well.
Yes, I will.
Thank you.
Bye-bye.
Aloha. All right. Well, we're so grateful to have partnerships at so many different levels with the County of Maui, as we've had before. But particularly, you know, we have new partnerships with Mayor Victorino and his team. And of course, we never expected any of this and never knew how many new programs we were going to need to be ramped up very quickly. But it really has been remarkable to see how quickly the county and the mayor and his team are ramping up to make sure that resources are available and programs are implemented as quickly as possible. Sometimes as we start moving forward with other funding sources and things, there can be snags or new things we have to consider in how we move forward given the funding sources, but they are working to untangle things and address the issues head on very swiftly. So we're grateful for the partnerships and the work that's being done. We also want to congratulate our board of directors, and some have served before, and we've got new folks coming to serve again, and new people coming on, but we just want to congratulate them all again. It's going to be an interesting but another great year because together we make remarkable things happen. Before I introduce our keynote address and Governor David Ige, I want to quickly review our process for the Q&A portion of this event. As the governor speaks or is getting toward the end of his speech and we're getting ready for Q&A, we will ask that you type your name and your question in the Q&A tab at the bottom of your screen. I hope everybody can see that, but there's a Q&A tab. Please put your name and your question. Now, if you're about to type and see that somebody else has already asked the question you wanted to ask, what we ask instead, don't put it in again, but upvote. There's a way to upvote that question, and that shows us the level of priority. So when you see that, it raises it to another level of priority, and we will start with the questions that have the most upvotes, if you will, that many people want answered. And then we will continue on going through each question to get to as many questions that we can as possible. What Amber will be doing is she is moderating this session. For those of you who are chamber members and even many who aren't, you probably know Amber. We call her the Chamber Angel because she and Daniel are in the office and in the background making things work while I'm at many different meetings these days, but they're connecting with each of you and getting things done. So she'll be asking the questions today of Governor Ige, so we can just streamline, make sure the questions are asked as quickly as possible. We're hoping to do this a little like speed dating so that we ask the questions quickly, have the governor respond, and get to as many questions as possible in the time allowed. So we now have that process in place, and I'll share it again after Governor Ige speaks just to remind you a little bit about the process, but kind of familiarizing yourself, if you will, with the screen and how you can upload a question in the meantime. So to now share a little bit about Governor David Ige. He was born and raised in Pearl City. He is the fifth of 6 sons and had a long and outstanding career as an engineer. He is the first governor in the United States of America of Okinawan descent. He began his political career in 1985 after being appointed by then Governor George Ariyoshi to fill a vacant seat in the Hawaii House of Representatives. In 1994, then Representative Ige was elected to the Hawaii Senate, where he represented his home district of Aiea, Pearl City, until 2014, when he was elected governor. During this unprecedented time, with all concerned about protecting the health and safety of our residents and our workers and our guests, while looking at how we shore up our economy and reopen Hawaii as quickly as possible. Governor Ige is the one everyone is anxious to hear from, as he has the overarching responsibility to approve county and state plans in times of crisis. And people are eager to hear those plans for how we reopen safely. Yesterday, Governor David Ige announced reopening Hawaii and waiving the 14-day quarantine for those who take a pre-travel COVID test and whose results are negative. To share more on this and his plans for moving us forward, we now turn to Governor David Ige to provide our keynote address. Welcome, Governor Ige. Thank you so much for joining us today.
Hi, Pam. It's certainly great to be back, and I appreciate the opportunity. These are definitely unprecedented times, and I look forward to my previous opportunities to be there at your inaugural in person, and certainly the current situation just doesn't allow me to do that. So thank you again for having this opportunity to talk with your members.
It's our pleasure. Thank you.
So I know that we had talked about a couple of different things. So I thought I would start with the announcement yesterday and kind of go through that quickly. But clearly, I want to provide time for your members to be able to ask questions of that, anything connected to the announcement, as well as anything that you want to talk about, as we usually did in past times.
Thank you.
Yeah, so thank you to all the members. I usually start by just thanking each and every one of you for your commitment and sacrifice to our community. We could only be successful if we work together in partnership, and clearly with the mandates that Mayor Victorino and I have been able to order because of our commitment to the health and well-being of our communities. You know, Hawaii continues to lead the country in the lowest rate of infections, lowest hospitalization rates, and amongst the lowest fatality rates in the country. So I just always start by thanking each and every one of you for your part. Yesterday, I did announce on the 3-month anniversary of ordering the 14-day mandatory quarantine, a new program for travelers entering the state beginning August 1st. The 14-day mandatory quarantine would continue, but we would provide for the opportunity for travelers coming to Hawaii to take a test, a COVID PCR test, prior to boarding their flights. And if they get a negative test, to be able to come to Hawaii and not be subject to the 14-day mandatory quarantine. We do view this as a way to, in a thoughtful way, being able to bring more visitors to our islands. I do know that the 14-day mandatory quarantine has been devastating for many. We went from the lowest unemployment rate in the country to the highest unemployment rate, or the second highest unemployment rate in the country in the matter of a couple of weeks. Excuse me. And it was primarily due to the 14-day quarantine. So we are working with the hospitality industry to really establish a robust program. We've had preliminary discussions with some of our pharmacy partners, really trying to build a network of service providers who would be able and willing to administer a PCR test to people wanting to travel to Hawaii. And if they were able to get the test and test negative within 72 hours of their departure, they would be able to come to Hawaii and not have to sit in quarantine. So, we do believe that this is a way that we can manage the risk of infection here in the islands and really begin to bring trans-Pacific travelers back here so that we can begin the process of restoring our economy and getting people back to work. We've been working with a number of other partners in different ways, trying to safely and without risking the health of our community, increase the number of travelers. I've been personally talking with governments in Japan and Korea and New Zealand to talk about establishing travel corridors with those countries. As we've looked at the pandemic all around the world, we've been looking for those travel partners that have managed the virus in the best way possible and have low rates of community spread in their communities. And we really feel that establishing travel between those locations and Hawaii would not significantly increase the risk to our residents because the prevalence of the virus is very low in those countries. On the domestic side, it's been really challenging just because, as you know, there hasn't been a national policy for dealing with COVID, and every state and county has really done something different in what each community felt was essential. And so as we've seen the virus contained in many Asian countries, it continues to really circulate widely. And in fact, we're seeing high new cases in states like California, where they had their highest counts in just the past week. Arizona is definitely seeing the highest level of the virus circulating. Texas and Florida are both seeing record spikes as well. And so certainly we do have concerns about domestic travel. And we think this whole idea of people wanting to come to Hawaii, getting pre-test and testing negative would allow us to bring them in a way that wouldn't put the health and safety of our community at risk. So, we know that we need to bring travelers back, and we want to do it in a thoughtful way. We have been working with the hospitality industry to really build a better industry, asking them to improve cleaning and sanitation standards, asking them to help us in educating visitors about being respectful of Native Hawaiian culture, about respecting our environment, and then finally expanding that to include being respectful from the public health perspective, and really being willing to work with us to assure that that they can come to Hawaii and enjoy our communities. But should they become symptomatic, or should they begin to show signs of the illness, that they will seek health services, and if necessary, we can test them and provide isolation and support services as needed. So, I think I'm excited about this opportunity. There is still a lot of work to be done between now and August 1st. And clearly, everyone is focused on ensuring that we can create a terrific program that can bring increased visitors to our islands in a way that does not jeopardize the health and safety of our community. So I think I'll stop there, Pam, and take questions, or I can talk about other things if you would want me to.
Oh, well, Governor, yeah, we can listen to you all day because we just so want to hear about all the things that you're involved in and doing. But why don't we start with the questions, and then if additional time allows, we'll get into other topics, if that's okay.
Sure.
Okay, so I'll just remind everybody, thank you, Governor, for that, and we're eager to let some people ask some questions. I just want to remind you, now's the time. You can type in your question at the Q&A portion of the bottom of your screen. Please put your name and your question. And if you see your question already there, just upvote it so we know that it's got a higher level of priority. And Amber, I'm going to let you take it away, asking the questions of Governor Ige so that he can respond.
Okay, great. Thank you. Governor Ige, we had quite a few questions about the testing to travel to Hawaii, such as the availability of tests on the mainland, if there's a minimum age for testing, if the cost is consistent across the mainland, and just if someone from Hawaii were to travel to the mainland, how can we know that they'll be able to get that travel test before they come back?
So thank you, Amber. Just a couple things. We have had preliminary discussions with CVS specifically, but we do intend to be able to expand the program to any pharmacy or health provider who is willing to participate. What we've been told by CVS is that we would establish a program between CVS and Hawaii. They would agree that anyone in their service areas who informs them that they would like to travel to Hawaii and participate in this program, they would be able to get tested, a PCR test, without the requirement that they get a physician's order or have to be subject to the health screening that is done in some of the communities. And they've committed that they would be able to deliver the results of that PCR test within 72 hours after taking it, so that, the whole notion of the program is that someone wanting to travel to Hawaii 3 days before departure would go in for a test and get a test result and then be able to travel to Hawaii. And when they arrive here, then show it. And then they would not be subject to the mandatory 14-day quarantine. We, based on the preliminary discussions, we feel confident that at least CVS would participate. And we are working in each of the major markets to try and identify partners that, if they agree to basically the same kinds of criteria and parameters, that we would be able to build a network of service providers in the markets that are important to us. We had talked about what that cost might look like, and CVS said, based on general projections, they had said that the cost would be about $140 per individual. $20 administration fee. At this point in time, we're requiring all travelers to get tested. I know the question about testing requirement for young children. We have been discussing that. At this point, we're saying that all in the party would have to be tested. But, we are consulting experts, pediatricians. I asked the question about, would you actually test an infant, for example, and would that be meaningful? We're working through the details as we speak and moving forward. We knew for the hotels and other partners that they needed to have at least 4 weeks notice in order to get ready to be reopened as part of the August 1st launch. So we wanted to make the announcement now, knowing that there are many details that we need to finish. I've also been talking to Governor Dunleavy in Alaska, and we've talked about a travel corridor with Alaska. Their numbers are very similar to ours here. And you may have heard that Alaska announced a pre-testing program for those traveling to Alaska. If they are able to get a pre-test, a negative COVID test 72 hours before arriving in Alaska, that they would not be required to quarantine as well. So we're working with them. I think as we build this network of people who want to be able to conduct the tests. We're joining with Alaska because their requirements are similar to ours. And so hopefully we can get to each of the markets that are important to us and have testing partners in every market.
Fantastic.
Okay.
Thank you. Our next question is from Billy Dirksen. As it pertains to short-term rentals, will condominium complexes, which are zoned for hotel or motel, be allowed to accommodate people requiring quarantine?
Certainly, Amber, that is a question that I've been working with Mayor Mike Victorino on. I think that there's general agreement, and I do know that your zoning is a little different than in other counties. So, my recommendation would be for you to check with Mayor Victorino's office. In general, I think that that what the policies being implemented across most counties is that short-term rentals that are legal and in area zoned for resort or hotels are allowed to operate. As you know, many of them are operate similar to hotels or timeshares in the sense that there is a lobby and a front desk, and people are available on the properties to provide information and support for visitors there. We believe that that's an important part of the quarantine and making sure that people can implement the quarantine. And for those of you who don't know, the quarantine is very specific. You have to go directly from the airport to the quarantine site without making any stops. And that once you are at the facility, you are not allowed to leave for any reason. Food and other things for sustenance needs to be provided to you. And there needs to be that kind of support so that can happen. And that's why, vacation rentals, even if they're legal, without that kind of infrastructure in place, would not be able to support a quarantine activity.
Thank you. Our next question is from David. He said, you and Lieutenant Governor Josh Green mentioned with the opening of travel that you expect our infection numbers to increase. Assuming there is no vaccine, is there a set point or percentage increase of the infection rate where the state will shut down again?
Thank you, David, for that question. I've been very focused and understand that to have to shut down again and issue another stay-at-home order would be disastrous for our community and our economy. And so certainly I've been conservative in the timing of reopening and relaxing of restrictions because I don't want to have to reinstate some of those very strict physical distancing and social distancing measures. So, I have been talking with Dr. Anderson and Dr. Park, and the sense is it's not so much the specific counts per day that we would be monitoring. What we are really looking at is trending in the number of counts, and really what is most concerning would be a doubling of the number of cases over a sustained period of time, which really demonstrates that the cases are growing out of control in our community. So, we are focused on a doubling of the average number of counts for each week for 2 consecutive incubation periods. So it would be a doubling and a doubling and a doubling and a doubling in a 4-week period that would have us most concerned. So, you can see, and we do know, we've seen an increase in the cases in the last week, week and a half. But they've again stabilized a little. 15 to 20 to 25 cases, I think, per day. We believe that we have the capacity, the testing capacity, the contact tracing capacity, and general healthcare capacity to be able to sustain those kinds of counts. It's different than what happened, in March and April, where, we were not as prepared as we would want to be. We didn't have the ability to test in the state. We did not have a substantial contact tracing network. And so certainly in the very early days of the pandemic here, when we were getting counts of 20 to 30 for a week at a time, we definitely were stretched thin. Today, I believe we'd be able to manage that without any challenges. One other condition that we would be very concerned about is whether our hospitals, the ICU units and the ventilators get to being overtaxed and overrun. So we do survey all of the hospitals every day to get an utilization of ICU units and ventilators. And we've been hovering about the 50% or a little less for ICU units for the past 3 months. And we definitely are not anywhere close to capacity for ventilators. We've been less than 20% utilization for pretty much the last 3 months. But what we have done is Dr. Park has established communications with the chief medical officers in all of the hospitals all across the state. And at least we've created that discussion and network so that we've asked them to monitor the utilizations in their facilities. If they get to the point where they would have a concern, if they could inform us. And Dr. Park is thinking that if we get to a majority of the facilities in the state filling up and getting to the point of concern, then we would evaluate where we are and whether we needed to take action. And also if we have a majority of the hospitals who really are overtaxed and above 90% occupancy and really struggling to deal with the patients, then clearly we would want to say that we need to pause and really encourage everyone to physically distance and stay away from each other for a period of time until we could bring the outbreak under control again. So that's just some of the things that we are looking at and trying to evaluate as we decide whether we should roll back or roll forward on some of these reopening plans.
Great, thank you. Our next question, we had a few people ask something similar. So with the date of August 1st set and most of the procedures in place or will be in place very soon, is there a chance that we could reopen prior to August 1st with a test in place, or would that possibly be an option for Hawaii residents to fly in and not have to quarantine with that negative test?
Certainly for Hawaii residents who are traveling, if they can, get tested before returning, 72 hours before departure again, and get a negative test, then just like anyone else, they would be able to be exempted from the quarantine. We are working in a very focused way in a couple of different areas to try and establish healthy and safe modified kind of quarantine situations for very specific groups of people. For example, we've been working with all of the universities, University of Hawaii, Hawaii's Pacific, and Chaminade, those universities that bring in students from outside of the state of Hawaii, and they have dormitories and other activities. And we've developed a modified program that includes testing. Obviously they'll be on the dorms or on campus. The university is taking responsibility for the health of those students, and it'll be a combination of pre-travel testing, testing after they get to Hawaii, but most importantly, that the universities would be keeping track of the health status. And should someone become symptomatic after arrival here, then they would be working with us to isolate them and provide them services. We've had extensive discussions with the film and digital media industry, talk with all of the unions involved, and establish specific testing protocols and protocols to restrict the production crew so that they would kind of be a self-contained group, and talking with hotels and others about a specific arrangement so that the entire production crew could be in a single facility, coordinate transportation from the filming site to the accommodations, and just working through a lot of procedures that would allow us to do film production in Hawaii in a safe way. So, we are looking at those opportunities. I know I've heard from many hotels and others in the visitor industry that, we're committed to finding these solutions that don't put our community at risk, that we can work in partnership with hosts here that would facilitate testing, allow us to identify individuals if they became sick after arrival here, and be able to provide them health services and testing if necessary, and then work with us to isolate them so that they don't infect other visitors or other residents. And so that's the kind of thing that we're working on so that we can bring more trans-Pacific travelers here to the state of Hawaii. And potentially it could be ahead of the August 1st date if we can work through these modified quarantine protocols.
Okay, our next question is from Karen Haley Allen. She said, Mayor Victorino alluded to quality versus quantity as regards to outside visitors arriving August 1st. Can you expand on what that means, and does that refer to more than testing?
I did have the opportunity to talk with the board of the Hawaii Tourism Authority, and I think all of us have been thinking about what does the hospitality industry look like moving forward. We've had 7 record years, and I was proud to be governor during that period of time where we saw increasing number of visitors and visitor spending, which we know is very important to our business community over those 7 years. But, this pandemic has really taught us maybe that health and other concerns are important. I do know, and I've spoken to many on Maui via video conference, town meetings, and other kinds of mechanisms about, with the fact that we haven't had many visitors here, our local residents have rediscovered our communities and certainly are concerned about the number of visitors. So when we talk about quality versus quantity, I think, we are looking for visitors that can have a couple of characteristics that we think are important now. First and foremost, again, we believe that respect and appreciation for Native Hawaiian culture and cultural practices. Clearly our host culture is important to all of us in different ways. We want to make sure that visitors and travelers here can understand that and can respect Native Hawaiian culture. Second is, and we've done it for a number of years already, Obviously our environment and our natural environment is a part of the attraction of Hawaii. Respect for our beaches and hiking trails and everything in the environment that makes Hawaii a very special destination. We want visitors who can acknowledge that and respect that and take actions that really support us in our efforts for 100% clean renewable energy, respect our efforts to really transform our energy usage so we can reduce greenhouse gases and be a carbon sink for the planet. I think that that's very important. And then now the third aspect in this post-COVID pandemic is really recognition that travelers need to be part of the solution in the public health challenge when we have infectious diseases in our communities. And so, working with the visitor industry, trying to work on education programs with the airlines, hotels, so that they can educate visitors about those three important elements of what we would constitute to be, a good visitor here coming to the islands. And I know that there are many other kinds of nuances in part of that, but I think that's what we would be looking for, is trying to identify those that can embrace those basic core values. We believe that they would be willing to pay more to be a traveler to Hawaii and be able to experience here. I had a Zoom conference twice now with members of East Maui along Hana Highway, and we've had the highway closed because we're doing highway repairs in that area. And certainly working with the community, we've dramatically decreased traffic along that highway. And the whole notion that, and Pam and your members probably know better than I would, but the Hana Highway is like second ranking in terms of what people go to Maui to want to be able to do. Haleakala is kind of the number one thing, and Hana Highway was number two. But what they shared with me was even though many people want to drive Hana Highway, the exit polls, the responses after they've done it was really mixed and lackluster. It's sort of like, they plan for it, they want to do it, they drive it, and it's like, boy, it takes hours and hours to do. They don't know what's special about it specifically. They don't know where they should be stopping. Especially on Maui, you get many, many independent visitors who just, read the books or social media and just do things. What the town meetings I've had with the community is, there are 2 or 3 very unique locations along Hana Highway, which would enhance the experience for visitors if we could develop them into better cultural sites. There are a couple of farm areas or taro, traditional taro lois along that highway, and other distinctive and unique experiences that, if we could limit the number of people going to Hana Highway, if we could identify the 2 or 3 or 4 very special locations and invest in making those individual spots very meaningful experience for those who drive the highway, schedule them through so that they would go from location to location to location and have very deep, meaningful experiences in those locations, that they would hope that the evaluations would go up. People would, suddenly have an experience that that would be meaningful for them, and we wouldn't have to see, the thousands and thousands that randomly drive Hana Highway just because it's the thing to do, and don't know what to look at or where to stop or who to talk to. I think that those are the kinds of changes that we'd like to identify and really think about how can we make it a different experience for both the resident and the visitor, and really end up with a win-win. The visitor really getting a more meaningful experience, help those nonprofits and other cultural organizations who are on that route establish a more meaningful experience for visitors stopping there, you know, and end up with a win-win with another attraction on Maui that would, you know, attract people for years to come.
Okay, our next question is from John Kevin. He said, what is the plan for a traveler who arrives and tests negative, but then 3 days after arrival, then gets sick and then tests positive for COVID? What do we do with the traveler and anyone they're traveling with?
Certainly, thank you for that question. You know, that's something that has been a concern of mine. And so I have reached out to the hospitality industry here, and that's what I put before them. You know, I think the hotels have to become a part of our public health network. You know, that testing them prior to departure is the first phase, but we really need to be focused on should they come here and become symptomatic, you know, we need to be connected with healthcare providers in the community so that they can get examined by a healthcare provider here, and we can evaluate their concerns. And if they need to be tested, we can get them a test. Then if they do test positive, then, you know, we need to make sure that we don't just discard them. You know, we need to make sure that they get an experience that obviously will be different because they are sick and they have COVID-19. But, you know, it has to be something that we can manage as a community. So, you know, some different hotels in my conversations, we've talked about, you know, they need to have plans of what they would do if they have a COVID positive guest. And certainly the state and the Department of Health wants to be able to help the facilities do that. You know, whether it's making sure that every facility has a plan about how they might isolate a guest within their property, or whether we have a plan that involves other properties and there's agreements between properties that, you know, we would want to have COVID patients in a few of the properties. You know, I think that that's something I want to work with the industry to kind of work through. I think it's just fundamentally important, you know, especially we have the opportunity to expand Hawaii as the best visitor attraction and destination in the world. And this public health component can be an extension of what we do already to, you know, keep our visitors safe and healthy and provide them the services they need, even if they have COVID, that they don't infect others in our community, that the facilities can protect their employees, you know, and make sure that they have the personal protective equipment that they need, you know, and that we can provide an environment that isolates them and doesn't infect any of the other guests or community. I think all of that has to be part of this system that we're creating.
Thank you. As a follow-up question to that, can you clarify what zoning or specific types of properties can house people who have to quarantine? And that was from Angela Leone.
You know, we've been working with the counties in each area to identify properties that would be used for isolation. You know, and from the state's perspective, it's visitors who come in, and clearly, if they have no place else to stay, we would be able to put them up in hotels. You know, the state does have a contract with a number of properties in every county to be able to provide isolation and support. You know, we do have instances where we have families with, you know, 8, 10, 12 multi-generations in the same house. And if somebody becomes COVID positive, it's really impossible to isolate them from the others in that home. So, We have moved them into an isolation facility that the state has contracts with with hotel businesses. Or in the reverse, we've taken the other family members who are in the property and put them into an isolation facility so that they are not living with a family member who is COVID positive. In either of those instances, we do know that, we have many multi-generational families in our community, and we have to have the ability to isolate infected family members so that the entire family doesn't get infected. And the department makes those arrangements and support individuals and families who are in those kinds of situations.
Thank you. Our next question, again, was asked by a few different people. Are the Department of Education schools on track to open on the planned date? Will COVID testing be used, and what steps will be put in place?
Certainly, I just met with the superintendent yesterday just to get an update. She is working diligently with all of the complex area superintendents. She's also meeting with private schools and representatives from private schools. We're working together and trying to determine what the school year will be like for all schools, public and private. She is on track to be able to complete the changes that schools will need to implement for both public and private schools. There'll probably be a process to finalize the plan. I believe the target date was July 2nd that they were working toward, and then obviously they would, provide information and allow people to see what the plans might look like. And then they're on schedule to finally adopt the standards and guidelines by July 7th. So that's kind of the time frame. I can tell you that there will be new standards for cleaning and sanitation of facilities. There'll probably be some kind of a different routine as children. We talked a lot about transportation and whether bus transportation is a safe environment for students. We've been looking at CDC guidelines, and clearly if children are wearing masks, and again, the parents have to be part of the solution. If children are sick, they cannot be sent to school anymore. They really need to be kept at home, because sending them to school would, have the possibility of infecting other children or staff at schools. So there will be a lot of changes and new procedures and policies put in place. We anticipate that it would be a blended environment of online learning as well as face-to-face sessions. And there's just a lot of details that the system needs to complete as part of this planning effort. I know superintendents discussing changes required with public employee unions, looking at ordering equipment that we would need to be able to implement the plans. We know that online learning will be part of the next school year, as well as other kinds of changes. So, stay tuned. For sure, the plan should be unveiled on July 2nd, and then there'll be another opportunity for input from the community, finalized on the 7th of July. And then, yes, the target date is still August 3rd. I know that in the informal discussions I've had, she's talked about, maybe phasing in the students coming back on campus. She wants the opportunity, I think, for the faculty and staff to be able to meet with the students initially in smaller groups. Definitely, we've talked about communication with the parents, talking about roles and responsibilities and the changes that would be implemented in virtually every school. And a lot of those kinds of details will be coming out, as I said, on July 2nd, and then finalized on July 7th.
Great, thank you. Our next question is from Marilyn Jorgensen. Do you have any current programs or any plans for commercial rent relief for small businesses?
I do know for those properties on state parcels, we have been working to provide rent relief for those tenants who are subject to state leases, and whether that be commercial or agriculture or other kinds of situations. So we are definitely providing rent relief in that fashion. For those who are delinquent and we've been having difficulties with prior to the COVID pandemic, we are continuing to pursue those tenants because clearly any deficiencies in lease or rent payments were clearly happening before the COVID pandemic. And so certainly we will continue to pursue payment of rent from those individuals or companies. So, we are providing support to the community as we can in most of the areas of leases throughout the state.
Our next question is from Anela Sanchez. Will unemployment rates increase for businesses due to all of the claims filed because of COVID-19? And how will this impact business owners?
Certainly, as most of you know, we were at the lowest unemployment rates for a while, and the UI trust fund had built up to the levels that essentially we reduced the UI insurance payments down to the bare minimum required. We are not adjusting any employers' ratings based on this pandemic. So, all of the layoffs and separations that has occurred because of COVID-19 would not be reflected in the experience rates of the businesses. So we're kind of taking this whole period and any of the unemployment filings for the different properties are not going to go into adjustments of your payments into the system. But as you know, because we were in this area where the trust fund was full, and we will be going to where we are actually borrowing money from the federal government, the premiums will increase to the level that might be appropriate based on the fact that the trust fund is empty. So we're going to try and stage that in as best a way as we can, as we are allowed to by the federal government. One of the things that we've been trying to do as part of the CARES Act funds, because we did ask very early on whether we could use the CARES Act to really repay any unemployment insurance loan that we would have to make with the federal government. And we did get confirmation that that's an allowable expenditure. So part of our plan is taking CARES Act fund, whatever's remaining, or actually from my perspective, we're trying to plan to have hundreds of millions of dollars available that we would be able to buy down the loan for the UI system so that, we could put that back into every employer in terms of not having to have increased UI payments for an extended period of time. Some of that savings would not really be seen because, obviously in very short order, we went from high unemployment to, for no unemployment to high unemployment. and the trust fund was depleted very quickly. So the increase, so your UI premiums will increase, but we're hoping that we can pay down the loan so that the time frame of repayment would be reduced.
All right, our next question, going back to the August 1st plan, is from Angela Leone. What happens if a guest arrives on July 30th? Will they then need to quarantine, or if they have a negative test prior to arrival, will they be able to not quarantine or get out of quarantine on August 1st?
No, they will be required to be quarantined. So if you have any guests, make sure that they arrive on August 1st or later. Don't have them arrive on July 31st. It's one of those things. The program starts on August 1st, and anyone who arrives before that will be subject to the previous rules, the existing rules, where everyone is required to be in quarantine. And so please encourage your guests to arrive on August 1st or later.
Thank you. Also on that note, we have a few people asking if you know how quickly CVS will be able to turn around a test results.
Certainly what they've told us is that the average turnaround time now is 2.1 days. So clearly, it would be a workable time frame. They are definitely aware that if we do this, it would be disaster for someone to walk into a CVS, take the test, get promised that it'll be, done on August 1st, and then not have it ready, and they depart on a flight to Hawaii. So, clearly that's something, we are committed to make it happen. Obviously one of the reasons we talk with CVS is that they do have stores here, and part of the verification and certification process, we're trying to make it as robust as possible. We want to digitize as much as possible. So, part of our preliminary discussions is that, CVS does have an app, and if we could tie that app into their pharmacy network, and, just like I know I have all of my health information on my chart with HMSA, looking at how CVS can help create a process so that if they came to Hawaii, they got tested at CVS, could we pull up their results on the CVS app when they arrived in Hawaii, so that if they forgot their certificate or their test result, we would have a simple way of confirming that they in fact did go to a CVS store on such and such a date in this location. They did get a PCR test and it did come back negative. We are trying to build that into the program as best as we can. We know that there's just a million details that we're working through. So, that's definitely something that we see in the long term. We don't want to delay bringing travelers back, until we have the perfect system. We're trying to build a system that gives us confidence that we are not exposing the community to significantly greater risk. But we also know that we want to build a system that works and then work to improve it every day as we expand and do a better job of reaching people and getting more travelers to come here.
All right, our next question is from Barbara Geary. She said, I believe the Department of Transportation allowed airlines to halt flights until the end of September. Will they be required to return sooner?
No, I mean, we have supported every request that I receive from airlines to be exempted. As many of you know, the federal government did provide financial relief to the airline industry. And part of that was that they had to restore a certain percentage of their routes and flights by certain deadlines. And I did write letters in support of United, I believe, and Delta, and they asked for exemptions from that requirement for flights into Hawaii. You know, they all of the major carriers continue to have flights to Hawaii, but on a very, very minimal schedule. You know, we've been talking with them as we develop these plans. You know, I do believe that they would be restoring routes and restoring flights as demand requires it. You know, virtually every airline that I've talked to that is providing flights to Hawaii said that if we can develop this pre-test program and people can get the test ahead, 72 hours ahead of departure, that the airlines would be adding flights as necessary to meet the consumer demand. So, you know, I think for the airlines, it's easier because all of them are flying way below capacity. You know, and all of the pilots and all of the flight crews need to have certain hours every month to remain certified to fly the airlines, the aircraft that they fly. So, you know, we anticipate that the air travel into the island would expand quicker. I know that the hotels need a whole lot more time to, you know, bring staff back on. You know, all of them are implementing new policies and procedures and programs to sanitize and clean the facilities. You know, and all of them I've asked to expand, you know, public health information as well as helping be part of our public health network. So, you know, there's just a lot of things that will be required before the first travelers come back on August 1st.
Okay, and this may be one of our last questions. From Rick Nava, how is the state planning to generate revenue to make up for the lost revenue from the last 3 months? And in the future, since we don't see our visitor industry, since we likely won't see our visitor industry be at the same level as before the pandemic?
You know, thanks. You know, I do know that, you know, we have to live with the revenues we have, and we see a significant drop in tax revenues. We're projecting a deficit. If we just kept the budget spending at the current levels, we would have a $2.25 billion deficit over the next 12 months. So obviously that's not sustainable, and we don't have the ability that the federal government has of just printing money and, you know, and issuing debt and kind of moving along. So, you know, I continue to speak with our congressional delegation every week to talk about the need for support for states and counties to help us plug some of the revenue gaps and program gaps. And, you know, I'm on a call with all of the nation's governors, and we all have the same challenge. You know, many of our states are dependent on sales taxes or general excise taxes in our case. And all of them have been severely impacted with a drop of revenue from this pandemic. So we continue to advocate for more support from the federal government. So that's one part of it. The second, I am looking at special assistance loan programs that have been created in response to the pandemic. The U.S. Treasury Department has a municipal loan program that allows us to borrow money at very, very low initiation costs and at very low interest rates, much below what we would be able to get in the market. So currently our financial plan is looking at borrowing between $750 million and $1 billion to really help get us through this revenue shortfall period. The municipal loan program is just a 3-year repayment program. So, you know, even though that allows us to borrow, we would have to pay it back over 3 years. And so it's helpful, but not the total solution. You know, I've ordered a hiring freeze and a cut of all discretionary spending across state government. And so we anticipate that that would help, recover a couple $100 million. And then finally, the last resort would be layoffs or furloughs of state employees. And I think the challenge is that, a lot of these people are employed to deliver safety net services to our community. They're involved with issuing food stamps and qualifying residents for Medicaid and other SNAP, other kinds of support programs. And, just like in our UI office, typically we only had 7 employees handling unemployment insurance filings, and then suddenly there were 200,000. And we had at one point more than 500 people, state employees coming from all the different agencies and other volunteers coming in to help process unemployment claims. And so, we will continue to see some of that kind of activity so that we're redirecting employees in those high need areas, safety net services, and reassigning them. But I do anticipate that part of the budget shortfall has to be made up from labor savings, furloughs, or pay cuts in order for us to balance the budget.
Well, thank you so much, Governor. And I know that's sort of a somber note to end on, as we started off talking about good things and reopening and trying to rebuild. And of course, the quicker we do that, that will help alleviate some of those losses that we're looking at. But, I appreciate you sharing that and helping businesses understand what your plan is, because each and every day as they're trying to move forward and manage, they're having to make those very same tough calls. And so understanding that government understands this and is looking at what is sustainable as well, is deeply appreciated. I just want to thank you for answering all of our questions.
Yeah.
You've been wonderful. I want to also thank Mayor Victorino for his thoughts today, and and for installing our board of directors. And we just want to say mahalo to our directors for serving, and mahalo to everybody who's participating on this call. I know you were eager to get to hear from Governor Ige, and we deeply appreciate you jumping in and sharing your thoughts and your questions with the governor. The Maui Chamber of Commerce is here to help all of us navigate through this new normal. We are partnering and there to serve both at the county, state, and federal level as needed. And we've been around for 110 years. And so we've helped the business sector and the community through other disasters before. Obviously, this is unprecedented times, but we want you to know that we are here to help. So, on all levels, please don't hesitate to call if we can be of service. We thank you all for joining in. Again, mahalo, Governor, for sharing all of this information. It really helps us plan forward and be stronger together. So thank you so much. And we just wish you and everybody else a wonderful day.
Thank you. Thank you so much.
Aloha, everyone.